how that's just so many synergies with what we're talking about tonight. I was, as of a few years ago, aware of how messed up healthcare is until I had kids. And so my quick story is I went to healthcare.gov, and I thought it was the only place to get healthcare. My employer at the time didn't offer healthcare, so went to healthcare.gov, got a plan for me, my wife, and my two kids. $1,200 a month, but I thought it was my only option. And I kind of joke it worked until I had to use it. So my little one, who was one at the time, kept having recurring ear infections. So any parents in the rooms, this happens often. So I went to the ear, nose, and throat doctor, who said, "Yep, got to get tubes in her ear. She's got a hole in her eardrum." So we went off to Dell, Seton Children's, and got tubes in her ears. We were there for 15 minutes, and we got the bill back. Anybody have any ideas what that bill was for 15 minutes? $8,000 for 15 minutes. I was like, holy crap, wouldn't we all love that hourly rate? Right? And so then the worst part is I get a note in the snail mail of all things, and it says, "It was medically unnecessary, so we're not going to pay the bills." This is my health insurance plan telling me this. I was like, man, like $8,000? So I had to stroke an $8,000 check to the local hospital. And it was at that moment that I was like, health insurance can say that they will guarantee that they'll pay the bills, but what I found is that 20% of claims don't get paid. They get rejected by your health insurance company. That's one out of every 5. So that's fine for a $150 pediatrician visit, but when you have some of these bigger bills, like $8,000 bills, that just doesn't work. And so I called my health insurance company. I said, I quit. If you're not going to pay my bill, I'm not going to pay your bill. And so me, my wife, and my 2 girls have actually been uninsured for the last 2 years. And the 2 best things that have happened to me over the last 2 years, the 2 most best things that I've done to find freedom is become uninsured and buy Bitcoin, right? Because in reality, what we're doing is we're working in a healthcare system that is fiat. Your health insurance plan is telling you what you can and you cannot do for your health, and it's 100% dictated by them, right? And so that's what we wanted to change at Crowd Health. So we changed it up a little bit. Right now, health insurance plan, you pay those premiums into your health insurance company. It sits in a pot of fiat that's melting, as we know, due to inflation, month over month. We thought, what if you could put money, each one of you could put money into your own bank account and hold some of that in Bitcoin. So instead of a big pot of fiat, you have a big pot of Bitcoin that's actually going to appreciate in value. And not only that, when you send your money to a health insurance plan, it's gone. It disappears. You never see the benefit of it. But those health insurance companies are actually investing those dollars in investments, and they get 100% of the profits of that. So they're using your money to get profits, right? In our situation is you're putting money into an account. It's about $175 per person a month, $695 for a family, into account. The account is yours. The Bitcoin is yours. Any appreciation of that Bitcoin is yours. So if you have money left over, you want to leave Crowd Health, guess what? That money that you in that account, it's yours. You take it with you. Right, so how do you get bills paid? Everybody's probably asking, okay, that's great if we can put money into an account, but how do I get my bills paid? Well, the great thing is that instead of an insurance company telling you what you can and cannot, get for your health care, we actually use the community to say that, right? So let's just say, for example, my daughter falls off of her bike and she breaks her arm at $6,000. I'm going to pay the first $500 of it. Then I'm going to go to 55 other people and ask them each for $100. You can say yes or no. If you say yes, $100 goes from that account that you have to me, and we're just going to keep going until we raise that $5,500 so that I have enough money to pay for my daughter's, broken arm. You might be like, okay, so why would I say yes to a random guy's, daughter breaking his arm? This is not like childhood leukemia or something that tugs at your heartstrings. Well, in that request for money, I also tell you, is this person a good member of community? Are they saying yes to other people's requests? So if you say no 9 out of 10 times, you have a 10 out of 100 reputation score. You're a Scrooge. You're a bad member of the community. I was joking earlier. It's like, if your next door neighbor's dog comes and shits on your lawn every single day, like that's not a very good member of the community, right? If he wants help, you're like, dude, your dog shits on my yard every day. I'm not going to help you. right? So it's like if you're a good member of the community, then it's more likely that other members will help you out if you have a healthcare bill. So it's community based, and the best part of it is just Bitcoiners. So you're going to be put into a group of people who are just Bitcoiners who are sharing their expenses back and forth. And so you can kind of look around the room, right? Most people are healthy. Most people, our average age is about 36. And so you're sharing your expenses with other people who are a lot like you. So that's how we work. I know that was super high level. For the first 6 months when you join us, it's only $99 a month instead of $175 if you use the promo code Bitcoin, so you guys can use that. So we just ask that, when you start thinking about your healthcare decisions, think about us, joincrowdhealth.com.